So next up, we have our first round of storyboard presentations. So we're going to be hearing just briefly from each of the teams. We've split them up into sections. So a few of the teams this morning, and then we'll hear from the rest this afternoon. I will be sharing the slides unless one of the team members would like to do that. We will have some time at the end of each section for some Q&A. First up, we have the Trail Oat Clinic, and I believe they are on the line today. Does someone from Trail want to come forward and present?
Sure. Hi, everyone. Right now.
Hello.
Hi, I'm Michael. Once again, Michael Smith. So we're the Oat Bomb. And we're gonna have some music. I thought we were gonna all right, so we got our big old team here. We got Karen and Tammy, Christy, and Jeff, who's going to be leaving us waiting soon. Sammy, Alexis, Michelle, Sarah, Cynthia, Kelsey, and me, and Steven, who's not here right now. And of course, you can see what each of us does. And on to the next slide, please. So our team operations. So these guys work really hard. I have so much respect for all of them. There's the nurse practitioner here at the Cairo Clinic in Trail, Tuesday, Wednesday, and Friday for their oat services. And they often, not just frequently, will join the outreach team on Wednesday mornings or Tuesday mornings or any morning, really. It's nice to see them out in the community. It's really, really awesome that they're doing that all the time. Registered nurses figures are on site here all week for the oat services because that was always really important. Outreach team of at least 2 people, one of them being an RN, is regularly available and out in the community. And once again, so important. Tuesday to Friday, meet us where we are, coming to us. With connections clinician, yeah, that's the word. Work closely with the oat team on Monday, Tuesday, and Wednesday, and we'll occasionally join the outreach team these days. And pure voices. Keep the team honest and real and provide valuable input in operational processes. Next slide, please.
I hate to interrupt. It's a little difficult to hear you. I can hear you for the most part, but I'm not sure if it's possible to move closer to the microphone or anything.
I imagine it's in the computer. Yeah. It's in the computer? Does anybody know that, Rick? Thank you. Okay, our aim statement, what we're trying to accomplish. We're trying to observe a 75% increase in our participation by January 31st, 2023. We're trying to improve the accessibility, stability, and active collaborative participation in our client care. Why is it important to do now? Well, the toxic drug supply is, well, it's bad. We can speak very clearly about that. It's bad. And it's an ongoing stretch that really, can we see the end of it any time really soon? I don't know that we can. We're trying to show a different face to the healthcare here, where they're coming to meet us and really focus on each of us as individuals on what we need. And I think they're doing a great job personally. I would dare anyone else to tell me differently here. The accessibility to clientele is volatile based on the recent and potential disruption to our housing and our basic human rights. In our shelter here, we're having a big old issue. If none of you have heard, you probably will be very soon. Yeah. All right, our learning state. Success is not linear. Everyone's path to success is different. Up and down, left and right, sideways sometimes. There are many different measurements of success that are not created by the healthcare system, but rather created individually by us clients. We need to focus on the client's goals and expectations, and not what anyone else besides the client thinks they should be. Otherwise, it just really gets confusing and frustrating, and really makes you feel like you're not being cared for yourself. You're just being cared for as a number. Really. We need to make sure to remind ourselves not to take any client setbacks personally. We're doing as much as we can for our clients with the resources available. And that is so true.
I think on the other side of that, the flip side as well, is that we also can't own the successes, that it's really the work of the client. We're there to support and stand alongside, but it is the work of the individual person themselves. So we can't take either to heart. We actually did something.
Kind of like a parent, you should stand back and be proud of your children and their successes, and not over criticize them for their failures, and keep on going. Okay, so here's our big old questions for everybody else. What works for you guys to encourage participation and consistent with daily witness ingesting clients that are precariously housed and vulnerable? Anybody?
Looks like you have a great list of questions here. I don't know if anyone on the line has anything to add about that first question there.
No? Okay.
I would say to that question is the role pharmacy and pharmacy deliveries has played for supporting clients on daily witness.
And that brings us to our next one. Do you have a strategy in place to assist the pharmacy so they're not feeling overwhelmed and burnt out? As I know some of our pharmacists are feeling a little bit these days. And how are your relationships with them? Anybody?
I would say, again, this really talks about that reciprocal relationship that we have with our pharmacies. So when they're feeling burnt out, there's been times where we've taken over daily dispensing, for example, for an individual who has been really problematic within the pharmacy. And so on the weekdays, we're doing the dispensing, they deliver, we dispense. And there's just this really collaborative relationship and kind of back and forth. And when they feel like they can kind of take that on again, we pass that baton back. And it's also about individuals having a choice to choose different pharmacies. If they're feeling like that relationship's getting strained, then maybe looking at another pharmacy as an option for a time being. I think it's just about having those conversations of how we can support the pharmacies within managing some complex behaviors that they might be experiencing. Or with the burnout piece, I think, the pharmacy's just problem solving about their staffing levels and the investment in which they put within their pharmacies to support the increased workload. We've also tried to do a lot of advocacy with the government, BC-CfE, and through our leadership on making sure that pharmacies are being compensated for the work that they're doing, because they aren't adequately compensated, I think, at this point.
I would agree.
Maybe we have time, maybe we have time for one more question. And then if we have time at the end, depending on presentations, we can come back to these.
Okay, well, I'm going to jump to the very last question because I think it's a really, really important one. What would you never do again? Any big old stumbling blocks? Anything that you suggest staying completely away from?
I think relying on phone calls for follow-up with our clients really did not work for us. Text messaging seems to be a lot better, but
Yes.
you know, a phone call to follow up a no-show is generally not going to work for our clientele.
Thanks so much. And I love your team's name, Oat Bombs. That's great.
Oh, bomb,
Oat Bombs. Thanks everyone for sharing. And like I said, if we do have time, we'll come back to some of those other questions you have there. And I can see that you have your contact information at the back here, which is great. Thank you. The next team that I have on here is the Vernon Oat Clinic. Do we have anyone from Vernon on the line?
That's me, and Kyle and Michelle have also signed on today.
Perfect. Did you want to share your slides or do you want me to share them?
You've got them up there. You go ahead. Sounds
Okay.
great. So hi, everyone. This is, we've named ourselves the Oatmeal Cookies. So one of our staff members who's enjoying Germany right now came up with our name. She's really good at dad jokes. So that's where our name came from, because you know, there's lots of ingredients that go into oatmeal cookies, and so we really felt that that was a great way to describe ourselves. We are very much a team-based care team, and so we have Dr. Mark, who presented this morning, Dr. Hill. We also have a new physician that started with us, Dr. Nagra, and a nurse practitioner who has joined us recently. That's Dawn Ansdale. I'm the team lead. We have Kyle Bolton is our nurse prescriber, our OAT nurse, Alicia McDonald. We've recently launched a Prescribe Safer Supply program for fentanyl patches. The nurses doing that are Krista and Nadina. And we have a community support worker, Sonia, and one MOA, and we've posted another MOA, but we haven't hired into that role yet, and that's Michelle right now. And we are really advocating to have peer support workers on our program, but we haven't gotten approval for that yet. So this is the team when we did the overdose awareness black balloon event today. So there you can see a larger team, including some of our other community teams as well. So our team was created out of the pandemic. So historically, Vernon has only ever had a external private clinic doing OAT called the Vernon Methadone Clinic. When the pandemic hit, we had a large number of clients who had to be isolated very quickly and supported with OAT to remain in safely isolated. We chose the oatmeal cookies because we have diverse client and staff population, also because we're just a snack, just a small piece of a bigger picture. So our aim statement is to increase attendance to OAT prescriber appointments by 25% monthly by February 1st. These are our raisins of wisdom. So we've increased communication with our pharmacy, and provision of OAT requires a community-based approach. So we're really recognizing how vital the pharmacists play, their key role in playing and engaging and supporting our complex clients on OAT who face multiple barriers within our community. So these pharmacies, you know, have just become such an integral part of our team, offering low barrier pharmacy supports to individuals, and that's just been such, I think, a huge success in clients being retained on their OAT treatments. So enhancing our communication between the clinic and the pharmacy and the client ensures that an increase of retention on OAT is happening. So you can see there our little diagram. So our questions for the collaborative is, how do you manage your appointment reminders? Do you have support staff for getting clients to their appointments? And do you communicate with your pharmacies about client appointments?
Thanks so much, Jennifer. Anyone can jump in if you have any responses to any of these questions. For example, the first one, how do you manage your appointment reminders?
So for everyone who has a cell phone, I send a text kind of the Friday before. Our clinic days on Wednesday. I phone the people who only have landlines, and then the people who have zero phone whatsoever, I send a fax to the pharmacy, and that's been going okay. And then I don't have any support staff I'm the only person here, and then, yeah, and I communicate with the pharmacies a lot. They're like my main team member. I talk to them a lot more than I talk to the doctor I work with, so.
Thanks for sharing. Anyone else have any comments?
Yeah, for the trail team, for our reminders and for support to get our clients to the appointments, we actually have outreach at the shelter that have been collaborating with us, and they've been supporting our clients. If we don't have a vehicle, they've been providing them with rides to get to appointments. And then as for communication with the pharmacists about clients' appointments, I'm not sure. I think Tammy does. Yeah, Tammy does that every week. Or, sorry, yeah.
And remind us to on the Monday.
Yeah.
Speak to your.
You've been asked to stop sending reminders.
But we can't hear anything you're saying.
Yeah, it's a bit muffled.
Oh, sorry. So we've been asked to not give them reminders at the pharmacy.
Because the pharmacies are feeling overwhelmed.
Okay, thank you. Any other comments from the group?
So for our appointment reminders, we did a bunch of PDSA cycles on this and landed on one where we have one of our peers every morning sends the text reminders for the appointments that day. That seemed to work better than doing it the day before, or doing another team member, or doing something completely automated, because he can actually text back when they reply they need to cancel or they're going to be late or whatever. It's more of a personal touch. We also, I'm going to see if I can drop this in the chat. It's just an image. Yeah, so you can have a look at that. If you're a bit tech savvy on an iPhone, you can create a shortcut program using that just makes it really quick for them to send a reminder text. So that's helped him send them without doing it completely manually.
Thanks, Cole, and thank you to the Vernon team for sharing that. It's great to see what you've been up to, and you have some great questions there, so we can circle back to some of them if we have time as well. Thank you, Jennifer, for presenting. I can see your team contacts listed here, so thank you for that. And we will share these slides out after the session today. I forgot to mention that, so that everyone has those. Next up, we have the Lillooet, Lytton, and Ashcroft team, and I believe that was Marcia who is the team leader. Do we have her on the line today?
Yes, you do.
Awesome.
And thank you, Vernon. That was a really impressive PowerPoint. I really enjoyed that. So I'm new to this. So I've got the Lillooet, Lytton, and Ashcroft. Came up with an LLA, lots of luck always. I really had to make that up. So it's a wide ranging 3 different clinics that is followed by Dr. Miller out of Lillooet, and administration, and then the support from the mental health team in Ashcroft, and usually there's an MOA or admin going down to Lytton and Ashcroft to support Dr. Miller. So we can certainly change our name. That was just for the moment. So in Lillooet, the accomplish what the aim statement is to improve the number of persons retained on oat greater than 90 days to 95% by February. Really good retention rates in Lillooet in particular. And then looking at increasing the number of persons on SUBLOCADE injections by 50%, finding that having the injections, there's less misses for appointments and like that no-show appointments, and also much more, no, I don't like the word compliance to be honest with you, but just folks aren't having the same amount of overdose issues. It Sublocade staying in the system longer. We're not seeing the challenges necessarily that we might see with the oral medications. And the more people that seem to be on it and doing well with it also communicates and networks within the community we're finding in that Lillooet Ashcroft area. Aspects of care we're trying to improve, just getting the numbers up, accessing OAT. Particularly in Lillooet, one of the comments is reaching out into the with the First Nations Health Authority, having access. It is a bit of an issue, and getting people to the locations. For really good examples, Ashcroft, there is no bus system in Ashcroft. So just transporting to clinic, just getting folks to clinic requires that either peer support that we're trying to build, and again, that the Sublocade comes in there because there's less frequent need for appointments. And it's important. We're feeling we're missing a good portion of the population because of those transportation issues. And just not the lack of peer support or having folks to help get clients to the clinics and the frequency of clinics. And Ashcroft and Lytton, the physician has to come in, a half a day every other week. So there isn't that ability to kind of manage around time constraints. And again, we're looking at Sublocade could solve some of those rural remote locations quite well. And it's doing well at the moment, but that's what we're seeing out there. Next slide, please. So back to that, the LLA area is increasing the number of persons on Sublocade injections, decreasing the need for appointments at the Oak Clinic. It decreases the reminder needs, and it's increasing retention. And they're working alongside members of the community to continue these retention rates. There's low to no overdeath rates through the work of peers in the community and active engagement in supporting OAT in those 3 small rural communities, and having the really good support of the mental health team. So I know when Dr. Miller has his clinic, if he's feeling, he needs a little more time with the client or someone's struggling, he's got the mental health clinicians right there for added support, or they can work their lap there and wrap their appointments around their OAT visit. And that's helping with that support and maintaining clients in the OAT program through that system. And next slide. I didn't build questions into this. I apologize. I have questions in my merit one. So the developing a reminder system with the goal of creating, it's going to be through the peer support. So the admin is doing some of that reminder. And Dr. Miller personally does a lot of that reach out for reminders with text messages and reminders, but it's not as easy in some of these smaller rural communities. So that's something to be working on. So feedback would be great. And thank you for posting up some of those in the chat too, just little tips and techniques for reaching people. The peer support in particular that I know we're looking at in merit, and then having that peer coordinator working out of the Lytton, Ashcroft, Lillooet area, big deal, because we can actually have the peer support worker or the peer support, that team can really help connect out into the community, get folks to the appointments, do the reminders, and it's because it's a smaller community that will work really well. And I think that's what we're trying to build in those rural areas. And then resources in the early development stages. So looking at who would also benefit from aspects of OAT treatment. So a question is, what are other smaller communities doing to help with that? The connection has to be at that grassroots level, honestly, just not the staffing levels as you might have like in Kamloops or Vernon or Kelowna. So that's my, the questions are getting that connection in a smaller community. If there's other, we feel the support worker, peer support would be really critical, and family, but what would that look like? And just developing resources.
Thanks so much, Marcia.
You're welcome.
Does anyone have any comments or questions? I know that I can see some notifications in the chat, but I'm not really able to open it right now. So
Angie, I just put in the chat. I'm wondering, so first of all, the sublocade is an interesting intervention, especially for rural populations, an obvious one that I just haven't thought of yet. So that's great. And I'm wondering, so you mentioned you think you may be missing certain clientele. Wondering, do they show up at other parts of the healthcare system, like Emerge or mental health otherwise?
It's an excellent
Thoughts around
question,
that?
Paul. Yeah, no, and I really appreciate the question. I'm learning the community, so that's, to be fair. What I've heard, just, you know, some of that the listening that we all do to the needs of the community, because of the challenges getting to these, you know, clinics, and the feedbacks. So the example I have, First Nations in Lillooet, I had a wonderful conversation. They have a fantastic peer support person through a different program out of Lillooet. An amazingly engaging, successful, recovered individual who just links out into the community. And his perspective is we're missing large swaths of folks that need to come in and be attached to OAT and would benefit from the program, but aren't engaged either because of transportation or the stigma, because clinics often are attached to a hospital or a clinic that's visible. And many clients are feeling persons are feeling they really don't want to be visible. It's obvious that the OAT clinic is on Friday afternoons or on Wednesday mornings. And the community knows this and they really don't want to be seen. So if there's a way to reach out into the community, have that nurse prescriber closer to home, and that's going to require some facilitation with other health networking, but those are misses, but it's coming to our attention through clients and coming to our attention through the peer support that we are missing folks, and no, they really are afraid to engage for the stigma reasons. I hope that answered part of your question.
Yeah, thank you so much.
thanks, Marcia. I'm just catching up on the chat now. I think we have time for one other question if there's anything from the group before we have a quick break.
I'm curious as to other teams' experience with that stigma, especially the smaller sites. If I grew up in a small town, and I can imagine if there was an OAT clinic in the, you know, you see the lineup on the street or whatever, that most people would be turned off and not want to go to that, or many people.
And people know each other, and
Yeah.
often, yeah, they do. It's the smaller rural communities. That's part of the like of it. That's part of the love of it. That sense of belonging. However, if you're stigmatized, or even there's a perception that you're being stigmatized, and that long walk up the hill, where the coffee shop's right on the corner, is overwhelming. And so I'd really like to have like feedback on working that around. But yeah, the peer support are saying that are already engaged in the community are saying, hey, we've got to do more reach out.
Okay. So I'm realizing, just looking at everybody else's wonderful presentations, that everybody provided a lovely list of the individuals connected to their team. I think the reason that I didn't do that is because we were a very large team and that would fill up multiple slides. But we were the Vernon Oat team, but we've affectionately called ourselves Team Outrageous, probably because we like to have a lot of fun, but we also have quite an array of wonderful personalities, and we somehow we named this a couple of years ago, and we've kind of just rolled with it. So that's us. Like I said, we're a very large team. Currently, we have 10 OAT providers, 9 physicians, and 1 NP. That's always kind of changing and in flux, and we're still always recruiting more. We have 4 OAT clinicians, 2 nurses, 2 social workers. We have 9 MOAs connected to us. I didn't include it on here because we're currently without it, but we do actually have a full-time peer support worker position as well, and we have quite a few offshoots of our clinic that's connected. So we have 2 virtual nurse prescribers as well, and also do quite a bit of work with our virtual addictions medicine, like our virtual clinic, and like a couple of our other services are connected to it, like our MedPatch program. But they're like little branches of a very, very large clinic. As you can see here, this is just the oat portion. We have, on average, around 1,000 patients connected to the clinic, so it's very robust. And we really kind of, I mean, because it's such a large clinic, we just work along a very large support spectrum to ensure that every client is seen as quickly as possible. That's our biggest goal, is that whether it be walk-ins or scheduled appointments, that people are seen promptly and they're able to get started on treatment as soon as possible. Don't miss those opportunities. So go to the next one. Sandy. So our aim statement, probably similar to some of the other clinics, is we're really just looking to improve retention, but specifically for clients with unstable housing. We changed our date because December is around the corner and that's not realistic, but we just find that we lose our clients who have that instability in their housing, who don't have proper communication pathways. So we're just looking at creative ways to try and increase the retention for those folks. Yeah, it's our most, well, as everybody knows, it's those very challenging individuals to stay connected when you don't know where to find them and don't know how to get a hold of them. When we're a clinic that does not traditionally provide outreach. So we have lots of wins, but the stuff that came to mind immediately was that we, as a result of our boost work, but also just a lot of advocacy from the team, we were able to get a full-time peer support worker a year and a half ago, I want to say. So it kind of just came out of nowhere, but a really wonderful surprise. And so that role has been really instrumental in supporting our clinic and really helping welcome people and help walk them through the process, supporting with missed dose follow-ups, and just really providing that lived and living experience perspective, not just for the team, but for our clients. And with a person no longer in that role right now, we're really recognizing the impact that it had and how much we're missing it. So hopefully we'll get that back soon. We've also, we've talked a lot about like text reminders and client reminders, and one of the things that we were working on in Profile for quite a while was getting automatic text reminders. So we do have a process for that now, so that's been exciting as well for those that are wanting to sign up for it. And we don't have to consciously do it, our system does it for us.
So
So we have lots of questions, and I really liked a lot of the questions that the other clinics had, and for us it's always really interesting to hear from other clinics, because I think we're a large clinic and we feel that way often, so we kind of just go day to day, and I feel like other clinics just have some amazing stuff going on that we could really benefit from, or see if we can infuse for us too. But we're looking to see if how other teams support those precariously housed individuals, and how do you help support them in retaining on oat treatment.
Does anyone from any of the other teams have any responses or comments to that question?
I'm in Kelowna as well, and I'd love to maybe get together and meet with you guys and see if there's any way I could help. I'd love to get into some peer support work. Woo. And if there's anything I can do to help out after we're done here, I could give you my information. And Dr. Baldwin was he's the one who referred me to this program, and I've worked with him, and he was amazing, and I just anything I could do to help out and give back would be awesome. So
Thanks,
We'd
Mike.
we'd be happy to hear from you, Mike. Thank you.
This is Marcy in Kamloops. In Merritt, the reach out with the nurse for those that are on black housing altogether or at the shelter or have tenuous housing or in an encamp style, there's a few encampment places. The nurse actually does an outreach to them to continue to help support their oat treatments. It's not, might be more out of scope a little bit in terms of like job description, but it's part of the role. That role for her is to go meet people where they're at and make sure that they're getting the transportation up to the clinic or are provided with their injection or whatever it is they're needing right where they are. So she's at the shelter a lot. So it's that particular nurse does a lot of outreach.
Thanks so much. I think that was Marcia. I'm having trouble seeing who's actually speaking.
Yeah,
but
that was Marcy. Yeah, and that's in Merritt. It's a busy clinic. They've got over between 80 and 90 active clients, and it's a busy clinic. And yeah, there's a lot of folks that are having housing issues. And then the nurses supporting maintaining that oat treatment. And then we've got the DARP program there as well. And so connecting them through, just even having the DARP counseling right down the street too is really helpful. But that's that outreach thing that I've talked about a little bit this morning too, is the necessity to get out. Someone's got to be able to reach out like that.
Yeah. Thanks, Marcy. I see Trail Oat there. You have your hand up. Go ahead.
Yeah, I was just going to kind of mirror what the previous speaker was saying. We have 2 days a week of dedicated outreach, and then our nurse prescribers will often hit the streets as well. And, it's a game changer being able to take your RNs and have them on the streets, meeting people where they're at, down at the shelters in particular, meeting people where they're at. It changes the entire paradigm of how oat is provided and makes it so that people can access it without having to, be on time for an appointment that, the chaos in their lives would regularly, be a barrier for them to show up to appointments or anything like that. It's just totally changes the game, totally changes who we're able to provide for.
I was just going to add to that. And then that partnership between the nurse prescribers and the nurse practitioner or GP is key. And then we are blessed to have collaboration with our mental health team. And so if people are looking for counseling, or we have a substance use, specifically dedicated substance use counselor that works here. If somebody has an overdose in the community, we have a dedicated person to follow up with that person, and those linkages between the emergency department and our program and mental health is we're blessed in that way. Although always more to do, but those are some of the pieces that have made, I think, our program really great.
Yeah. Anyway, there you go. That's us.
Thanks for sharing. Thank you. Thanks, Sam, for presenting on that. If any other questions or comments come up, you can just put them in the chat, but we're going to move along and then we can maybe come back to that. Thanks again for sharing, everyone. And your team contacts are listed there. And again, we'll share those out after the session. So thanks for that. The next team we have up here is the Castlegar Oat team, 10th Street Clinic. Do we have anyone from Castlegar on the line?
Hello, yes, I'm on the line. Becky.
Perfect. Thanks. Hi, Becky.
Okay, so yeah, we're here in Castlegar. I'm not great with PowerPoints. It's an older clinic around here compared to the other ones in the region. So kind of lots of people on methadone who've been on methadone forever, but it's always changing a little bit. Right now we're supporting about 90 clients in the Kootenay boundary, mostly in Castlegar, but sort of all over. Let's see. Oh, and then, yeah, the next slide. So Dr. Van Vliet, he's the main guy, he's been running this clinic since 2013. He actually took it over from his dad. It used to be a private clinic. And then, so he's just here Wednesdays, but he's pretty available. I'm here Monday to Friday, sort of just everything related to the clinic, and so grateful to have Megan when she's available, our MOA. We share her with the nurse practitioner, but she's in charge of all the admin things and keeps us organized. Added in my note, lots of client and nurse support. So sometimes it's lovely just being just me and her, but she's lovely. I always fantasize about going back to the Trail Oak Clinic because I worked there before, and it's such a tight team and I miss everyone. And then Karen Lehman is the team lead and the acting manager here as well. And she's just been a good motivator for having the meetings with Kelsey and nailing down that aim statement. So our aim statement took a while to figure it out because I was being too broad. I didn't really, QI is really a very kind of focused thing to have it be smart. So just to increase Oak Clinic attended Oak Clinic appointments by 80%. Obviously, missing out on people disrupts their care and increases our workload. So just finding any way to help people get here. So our learnings to date. So we were sending appointment text reminders, but sort of just as like a message. And there was a couple times where it kind of got lost in sometimes I just text with people other things. So there was times where they weren't realizing that there was an appointment reminder in there. So we sort of just wrote it now as like how the hospital sends appointment reminders, like if you have an ultrasound or stuff like that. And we're just pretending we're an automated thing, but they can text back to change their appointments if they need. Just really making sure we have all the correct contact info for people has been big. And then getting the right permissions to talk to their families. There's been some times where we really would have been good to reach out to family a little earlier, for sure. We've had some not great things happen throughout the year. So, but, and then the Sublocade clients, I just sort of had lost track of a couple of them. So just remembering, still checking the Pharmanet, even though they have their longer prescriptions for the monthly thing. I realized someone had been taking their regular medications and they really need to. So just remembering they're still in the program and then what their needs are. And then just seeing this year's kind of new clients and discharges mapped out. I kind of just made a list of who left and why, and it was just interesting to see that. And I think that's I didn't make questions for the group because I just sort of, I don't know, I missed that slide somehow, but yes, that's it for me.
Thanks, Becky. Yeah, no worries. I mean, do you have any questions from what you've heard so far or any comments or?
I think it's not anything specifically. It's just been interesting to hear about all the different formats, and Kelowna Oat is massive. That's exciting. And it was really cool to hear about everything that Vernon started doing out of the pandemic and how that's changing to meet the needs. So
yeah, I agree. Any questions for Becky from the group?
Mike's hand.
Oh, sorry.
Go ahead, Mike.
It's not really a question, it's a comment. I agree a lot with the making sure you have the correct contact information for family and supports. I know for me, I was very ashamed. So I didn't want my parents and my family to know where I was or what was going on. And it did take a peer support worker to convince me and help me realize I can reach out to my family. They had to almost pull me kicking and screaming at one point, but she, as mad as I was at the time, I was very glad she did reach out. And it wasn't actually so much her that really reached out. It was my sister apparently calling the shelter every day
Oh,
and making sure I was okay. And finally, she just said, she sat me down and she kept hounding me and talking to me and telling me to, and that's something I think needs to be expressed to a lot of people is your family's not going to be ashamed. They want to be there for you. They want to help you. And I think that is something that a lot of the peer support people and counselors need to be able to express is that your family, they wouldn't be looking for you reaching out if they didn't care. And that one really hit me hard because I wouldn't give my family information because I was afraid they were going to be ashamed of me. But I think it's something that they could work on is just expressing how much your family loves you and how much they care. And if they didn't care, they wouldn't be trying to find you and help you. So I really liked what you said about that.
awesome. Yeah, and there are some people who like, if we maybe we don't have permission to tell their family things about them, but we still like develop pretty close relationships with their family, and like we can just get information the one way and sort of chip away at our client of like,
That's
just like you have these people are here and like they care.
That's
So,
what happened because I had my dog with me at one shelter and I wanted a better life for him. And so I asked my parents to come get him. I didn't want him to step on a needle or something. And then all of a sudden, oh crap, now they know where I am. And then my sister apparently was phoning every day or every second day to the shelter just to make sure they couldn't give her any information, but they just would tell her that no, he's alive, he's okay. And she finally just got fed up and she drove out there and they basically forced me. And I thank them every day for it because as hard as it was to get me out of there, since then it's been tough, but it's been worth every goddamn minute of it. Just and I can't thank them enough for what they did. The support people there, my family, my friends, all that. So I think it's a very important thing for clients, families, just let them know they're okay. And then slowly, like you said, chip away at them and they'll eventually come home.
yeah, it's great when it lines up. It sounds like it lined up for you. That's amazing.
It did.
Started going with the dog, hey?
Hey, that's why I got this little one right here.
Amazing.
Thanks so much for sharing, Mike.
Thanks,
And
guys.
thank you, Becky, for your presentation.
Angie, I just want to mention, well, thanks so much, Mike. You've got me reflecting in the importance or like the potential of involving the family and asking about family. Family could be in the broadest sense as a support system. I'm reflecting on how I think we all agree that's a good idea. And despite me going through multiple boost collaboratives and hearing this message repeatedly, at my clinic, we still haven't found a great system to make sure we're not missing that, right? So in the context of a busy clinic, when people come in with multiple issues already, how do we use our QI methods to make sure we're not missing this important piece of the puzzle? So I was thinking about it just with, saying up-to-date contact info is good. And we all agree with that too. But again, it's the easy to say, hard to do aspect. And the same goes for this family involvement. So maybe some of the teams have some ways they share that they're checking for this in a systematic way or recording it in a systematic way. I haven't found the perfect one for the family piece yet. We've done some work with the contact info, but again, it's a hard one.
Yeah, and I guess I'm fortunate because it's a pretty small area, so sometimes I'll see someone's mom at the gas station and stuff like that too. But yeah, it's hard to keep it updated because everybody changes their phone numbers all the time. But the big part is just working on it with the person of just trying to like gain more access to their family, I guess, when there's time for that. Trying to invite family to appointments as well. We try to do more of that when it's helpful, but
Well, for me, I know my first few appointments with Dr. Baldwin, well, my first few, I had my mom and my dad with me. And then every time they drove me, they would come in, and then as I was progressing and doing better, they would come in less and less. And I found it very helpful to have them there, not just as support, but to keep me from BSing the doctor, because they knew what was going on. And if I tried to say, oh no, I don't use that, or I don't do this, or they'd be like, Mike, you got to be honest with them. And I felt it helped a lot to just have them there, both for the support, but to also keep me, because addicts, we can spin a little bit of a tale. And it helped just having them there, just to keep me on track, keep me in line, but also as support to tell me it's okay, to put their hand on my shoulder and just say, come on, just be honest with them. And so I think that's a big part of it, is having family there. And family, again, doesn't have to be blood. Like I said, it could be a friend, it could be someone you care about, someone that's just been with you through a lot. And it's just someone that's that wants to, you got to hold yourself accountable, but someone that's going to hold you to holding yourself accountable. Because if you're just going to lie to the doctor, you're just lying to yourself. And you don't want to do that if you're really serious about getting better. And I know how hard it is, but you don't want to lie to yourself and then just backslide. So having someone there to hold you accountable, I think, is just as important as having someone there to support you.
Thank you, Mike. We are going to move along. I think we have a couple teams left to get through here. So up next we have, if my mouse works properly, we have Merritt. So that's Marcia again. She's the team lead for both teams. Marcia, are you on the line?
I am.
Perfect. Hello.
Hi there, and thank you, Mike. I really appreciate the depth of your sharing. Much appreciated. So I'm covering Merritt as well, a little bit different of a community than Lillooet and Ashcroft. I think I was mentioning before, Merritt is between 80 and 90 active clients. And they've been through the collective trauma in Merritt, fires, floods, pretty much everything you can think of. There's a lot going on in that little place, lots of stressors. And it's quite transient of a population as well. So I gave them the Merritt Marvels. It's a understaffed, overworked, busy place. And what they are able to do is marvelous, to be honest with you. Best that they can, and that reach out into the community is amazing, even considering it's only one nurse. Dr. Soderberg works a little bit differently than most of the other clinics that I'm aware of, because he's more private. It's sort of private practice, so it's a bit more challenging to get numbers, but here we go. So we're looking at by February having 70% of persons referred to OAT remain connected for service for more than 12 weeks. And again, with that remote kind of rural looking at increasing the numbers of persons on Sublocade injection by 50% was the realistic percentage increase there. That's just, Dr. Soderberg has quite a few people on Sublocade. It'd be really great to get to work at getting that improved. And again, that's because there's a lot of issues with connecting transportation, having people up to get to the location is challenging at times. The location won't be changing, so we have to look at how can we get clients looked after in a better way. And a lot are coming from long ways. So Logan Lake is covered through Merritt. How are folks getting there? So looking again at Sublocade is a really good option. And then overall numbers of persons accessing OAT is that, again, same aspect of care that I've come across with Lillooet, Ashcroft, and Lyddon, is having been told and have it identified to us that many people are not accessing it because of the stigma, because of the what Mike was saying, just having whatever family means to you, so that the peers, the family, someone to accompany them, the reassurance, all those things are fall underneath that. What are we doing to increase our access for the oat? And this is the exact same story with attending follow-up clinics, not feeling alone, not feeling isolated, having transportation, arranging for someone to come fetch and drop off, bringing a sandwich along. I know the nurse in Merritt's really does her best to make sure that she's got Boost. We order boxes and boxes of Boost just to make sure there's, you know, a protein drink when someone's being brought or taken home from home, things like that, simple things like that. Yeah, big, huge. Have it chilled is even better. I don't even like it coming out. Yeah, exactly. Like Boost for Boost. And it's important for that follow-up. Yeah. Okay. Sorry, I can't help myself. I can't read this. Okay. Retention is that's why, like, it's important. And also, as we retain, we're finding that then those clients are bringing folks along. I don't know what, Mike, what your experience is, but as we are seeing people coming through and they're having a positive experience, they're the peers that are nudging a friend or someone that's at the shelter to come with them. And it might not work that time, but maybe 5 times later. So we're seeing each one teach one. As we reach someone, they're reaching a peer. And as that peer reaches someone and having a positive experience, we're improving that access and that retention. So next slide, please. Merritt is doing, Dr. Soderberg and the nurse there, and Paula, who's the admin person, who's amazing, increasing that Sublocade injection. Again, it's decreasing the number of appointments. That opens up appointment times for the physician and the nurse prescriber. You're not having to see them as often. Every 28 days opens up space too. So that was important. And we're seeing a better retention rate, and decrease in overdoses. You're just less likely to have that impact if you do use when you're on the Sublocade. It stays in the fatty tissue for quite some time, that, as we know from the statistics, from the data, right? And working alongside the community needs is increasing those retention rates, low to no overdeath rates. So the questions kind of center around all these things too, by the way. There's no overdose. The low to no overdoses is really a marvel, to be honest with you. And again, those early resource developments in Merritt, very community specific for persons in Merritt, because of the complex issues in that community right now. Many are still unhoused from the floods, let alone other issues that cause homelessness. But there's still folks living in the motels and hotels. Yeah, it's complicated in Merritt, and they're doing their best, and they're very short-staffed. There's a note in
Thanks so much. Yeah, I see one more slide with the team contacts.
Yep.
Yes, thanks so much again, Marcia. That's your second presentation of the day.
Yeah, and my questions for collaboration were pretty much the same as before. So,
okay, perfect. I have them up here if anyone has any comments or questions for Marcia.
Please do.
We can also share these out afterwards. I think there was a question. There's a couple comments in here. How many people do you have on Sublocade now?
In the Lillooet, Ashcroft, Lytton, it's there's about 71 to 75 active clients in that location with Dr. Miller, and there are 30 of that number on Sublocade, and in Merritt it's about the same, 25, I'd say.
Great, thanks. And then there is a comment from Jessica here. She says, I just wanted to address why people who use substances feel the need to lie to service providers and get into routines where we are dishonest. It is not because we have bad morals or our substance use is a moral failing. It is a direct result of colonialism, stigma, criminalization, and failed drug policy. Thanks for that, Jessica. We do have one more team, and I do want to make sure that we get to them. We're running a few minutes behind here, so sorry if I'm rushing through these slides. Our last team is the Salmon Arm Oak Clinic, but I'm not sure if any of them are here. Is anyone from Salmon Arm on the line?
She's working alone and she has no MOA today, so she was sort of jumping in and out, so she might not be here.
Okay, that's okay. They'll be included in the slides that are sent out to everyone. Thanks for letting me know that. So I just wanted to say thank you to all the teams for sharing. I think, you know, that's one of my favorite parts of these learning sessions is getting to hear what each team is up to. And I find it really interesting. And I think, you know, it elicits a lot of good discussion. So thanks very much again. And I look forward to kind of seeing some updates on that at the next learning session. So yeah, looking forward to that.